I was not looking to tackle any taboo. It just made total sense to me. I thought this is a pervasive problem. More than 50% of women will deal with vaginal health issues. I'm in the field of medical aesthetics, so I'm working with these technologies to rejuvenate the skin. Why aren't we doing the same down there with a woman's vaginal tissue? Let's make this super easy for women using technology that's been around for decades, that's proven, that's safe, and there you have it.
What happens when you trust your gut before the world is ready to hear it? Today's guest turned a quiet moment of frustration into a global FemTech movement. Colette Courtion walked away from a thriving corporate career to build JoyLux, a red light therapy device for pelvic floor health that's transforming how we talk about menopause and intimate wellness. But getting here, that took resilience, a lot of rejection, and a relentless belief in herself and her product.
So I was pitching men, and I would walk into a room and these men were typically in their 50s and 60s. And I'd be like, I'm here to talk about vaginas. And they would turn bright red and start, looking the other way and shuffling their papers. They could barely get through the meeting.
Now, with Halle Berry as an investor and partner and a recent feature on Oprah's Menopause Revolution special, the world is finally catching up.
I got a phone call and on behalf of Halle Berry. And she would like to talk to you about JoyLux and VFit. She was on the Drew Barrymore show, had an incredible talk with Drew about our products. And then we literally had our Oprah moment. And I was in the audience watching her talk to Oprah about me. She said my name. And I literally started to cry. But when Halle came on board, she was a validator. And that in turn allowed everybody to be like, I get it now. It's the real deal. JoyLux is the real deal.
Today's guest left a successful corporate career to challenge one of the most taboo topics in women's health. And she's done it with boldness, brilliance, and a red light. Meet Colette Courtion, the powerhouse behind JoyLux, who's transforming how we talk about menopause and intimate wellness, one unapologetic product at a time. Welcome to Redefine Her, Colette. I'm so glad to have you here.
Thank you, Brenda. I'm just thrilled to be here.
So great. Let's just jump right in. Let's start at the beginning, not just of JoyLux, but of the shift. You had a thriving corporate career at Starbucks, launched Calidor Skin Clinics, and led in beauty and biotech with Geno Biosciences. But at some point, you made this radical pivot from building brands to breaking taboos.
Yes. Little did I know I would be such a taboo.
We would think that it shouldn't be a taboo, and it still is, isn't it?
Absolutely. As you mentioned, I spent the majority of my career in what we call medical aesthetics. So that was my experience founding Calidor Skin Clinics and then being part of Geno. And in that position, I was working with all the latest in anti-aging technologies for skin rejuvenation. So how do we turn back the aging clock on our face using lasers, lights, radio frequency, ultrasound, you name it. Those we call energy-based technologies. So as I'm rejuvenating this up here, I became pregnant with my now beautiful son. At the time, I was what they call a geriatric mother. So I was 42. It's hard to get pregnant at 42, but God blessed me with Coleman. But after I gave birth, I experienced firsthand what women go through physically with the changes in their body. So the pressure of childbearing and then childbirth really wreaks havoc on your pelvic floor, your intimate health. And then if that wasn't bad enough, I was going into perimenopause. So I was dealing with these symptoms on a much grander scale because my estrogen was dropping and I was going into my menopausal years. So lots of bad things happening. And this is when I had my aha moment. And it literally was like that red light went off. But I was like, well, wait a minute. I'm in the field of medical aesthetics. So I'm working with these technologies to rejuvenate the skin to basically tone, tighten it, improve the health of it. Why aren't we doing the same down there with a woman's vaginal tissue? So I went to my doctor who delivered my baby and I said, here's my idea. And she's like, yeah, I think that would work. So then I went and teamed up with a very smart technologist, Dr. Nicholas LaBelle. And basically the three of us came up with what is now VFit or VSculpt, depending on where in the world you are. We have two different brand names. And this was the part that shocked me the most, Brenda. No one had thought of this. we became the world's first to take energy. And we chose red light because of its safety profile. It's incredibly safe. But we were the first to take high powered red light technology and place it in a device that women could use intravaginally to rejuvenate their vaginal tissue, to tone, tighten, improve blood flow, increase natural lubrication, and address all these symptoms that women face after childbirth and then going into menopause. And so here we are 10 years later with VFit, and it is truly a game changing technology. And we now hold over, I'm pretty sure, 24, if not more, issued patents on our technology.
That is amazing. So Coleman and menopause really gave you the green light to go.
Look at, I was not looking to tackle any taboo. It just made total sense to me. I thought this is a pervasive problem. More than 50% of women will deal with vaginal health issues, whether it's vaginal dryness, atrophy, incontinence, pain with sex, dyspnea, a huge percentage of women that deal with these problems. And right now, there aren't a lot of solutions. So I just said, let's make this super easy for women using technology that's been around for decades, that's proven, that's safe. And there you have it.
And I've had the privilege of talking to many women on Redefine Her who are leveraging technology in a way that we haven't used before, that we haven't done before. And as you said, 10 years into this pioneering technology, like, how have we not done this before? But women's research is underfunded, underdesigned, underevaluated, underconsidered still in 2025, and still shrouded in some shame a little bit. Even physicians are not that well educated on it through school. I think they get a little bit of education unless you dive deep and go further. What's one insight you've uncovered that even insiders might not realize?
Going back to when I had this aha moment, and I'm like, clearly someone has thought of this, and they hadn't. And the reason being is that historically speaking, most inventions, not all, we have some killer women out there that have created some really game changing inventions. But historically speaking, most of the inventors have been men. Most science based people are men. Because this is a topic that is, as you said, taboo and isn't talked about, there was no innovation in it because men didn't know it was happening because women aren't talking about it. And you tend to invent in a space in which you have personal experience or passion for. So had I not experienced it, I would have not known how big of a problem this is. And so when I look back, it took a woman, me, that had this personal connection to it to then innovate in this space. And what I am seeing now, and what is so inspiring to me, is that we are seeing an influx of women inventors and women entrepreneurs and women that are pushing the boundaries and saying, no more. We shouldn't be suffering. We should have solutions for this, whether it's FemTech or other things. I'm just so excited to see this women embracing technology and doing something with it because trust me, we are as smart, if not smarter than our male counterparts. So finally, we have the ability to make things happen.
Most definitely. The term femtech still relatively new in the grand scheme of life and the big picture. What has inspired you about that? Because you've been right there along this whole journey when it comes to femtech, medical aesthetics. That was
Yeah.
for women's wellness. It was leveraging technology and very deep science to create tools that helped women. And now here you are with JoyLux.
And now I'm tackling something that is, as you said, shrouded in taboo. At the end of the day, I like to make a difference in women's lives. I guess we could get some deep analysis of my relationship with my mother, but at the end of the day, I just really like to help people. And I have taken a personal quest to help women. And so what inspires me is when I see how we are transforming the lives of women and we're improving their quality of life. And when you have a customer handwrite you a thank you card saying, thank you, you gave me my life back, my marriage is saved, I have confidence, I can do the things that I couldn't do now thanks to you. That's what inspires me. That's what keeps me going. That's what keeps me willing to fight the fights and tackle the lows and come out stronger and better, is because I know at the end of the day, what we are doing here at JoyLux, what our team is doing is transforming lives. And that to me is incredibly inspiring. And so when I look out at all these other female entrepreneurs in the FemTech space or other spaces, they too are doing that. And it's just so incredible to see this group of women working to make a difference in our world.
We walk on the shoulders of so many amazing women who have come before us. And to be able to do that and repeat those successes in a way that extends even beyond what we thought was even possible, it's just really so impactful. I was reading some of the reviews on your site for the VFit device, and it's been totally life changing for people. And as you mentioned, those thank you notes, it's a lot deeper than one person.
Yeah, I call myself the ultimate consumer. There isn't something I don't own or wouldn't buy. There's been nothing in my life that's been so transformative that I've actually taken the time to handwrite a letter, let alone an email to a company saying thank you. So when I get handwritten letters from our customers, I know we're doing something right.
Most definitely. I'm not getting those thank you letters. You are, but from what I see on your website and the reviews of this product, just absolutely amazing. So, congratulations. You entered FemTech really before it even had a name, and before most investors even wanted to hear the word menopause, let alone vaginal health or pelvic floor health. What was fundraising like in those early days of
Oh
JoyLux?
my gosh, it was brutal. It was brutal because the interesting statistic that I leaned into was, yes, we're talking about vaginal health, which ultimately is about sexual health because we're helping women restore the health of their vagina, their pelvic floor, which allows them to lead to better sexual interaction. If we're able to reduce pain with intercourse, they're going to have more intercourse. And so, what I was shocked about is before I got into this, before we formally formed the company and started working on our technology, I looked at the sexual health market and it's massive. At the time, this was 10 years ago, it was a $15 billion industry in the US. And I remember a friend of mine who worked at Amazon during the time shared with me that the little known secret of Amazon is that 1 in 4 packages have some sort of sexual toy associated with that package. So people were going on to Amazon to buy their vibrators or their lubricants or whatever to help them with their sexual health and their intimacy. And so I was like, well, clearly it's such a big market. There must be investors out there that aren't afraid to talk about vaginas and sexual health. And boy, was I wrong.
Yeah, I bet.
It was incredibly challenging. And at the time, when I was fundraising early on, the whole female investor movement wasn't there yet. So I was pitching men. And I would walk into a room, and these men were typically in their 50s and 60s and were your stereotypical white male and gray hair, and I'd be like, I'm here to talk about vaginas. And they would turn bright red and start, looking the other way and shuffling their papers. They could barely get through the meeting, even though I would talk about how enormous this market opportunity is and what we're offering is truly game changing. So, in one of my meetings, there was a gentleman just like the rest of them. But afterwards, he came out and he pulled me aside and he goes, I like what you're doing. I think you're approaching investors wrong. And I was like, okay, I'm ready. Let's bring it on. Tell me what I'm doing because I need to raise money for this. And he's like, two things. One, at the end of the day, investors are investors because they want to make money. So rather than lead with you're here about to talk about vaginas and how many women are suffering, really lead with the numbers. Talk about how this is a big investment opportunity and just focus on numbers. You could be selling a widget and they're probably indifferent to that. What they really want to know is how much money they can make. The second thing is make it personal for them. they can't relate to women having dry vaginas, but they certainly can relate to their wives not wanting to have sex with them. And why? Because most men don't know why. They have the blue pill, they're eager to get busy, but their wife is saying no, and they don't know why, because women were afraid to talk about it. We're afraid to talk about, we don't want to have sex because it's painful. So I did shift my approach, and I did focus on the numbers, and I did focus on what's in it for them. And things started to change, and I started to get investors. And then thankfully, at my next round, women and women investors started to become a thing. And I was able to really get some of the top female angel groups, small female funds that were focused on women and underrepresented groups. And I got them involved in the company. And then they've been basically supportive ever since.
That's brilliant. I'm really leaning into listening to an investor and their guidance because it is very personal. Men have wives, men have sisters, mothers. They have people in their circle, inner circle, or deeper, broader circles who do suffer from these things. But it still is that educational component and helping them see that light. And for you, continuing to believe in it. This is powerful. This is something that's going to help them. I love hearing that. Do you think anything has shifted meaningfully from 10 years ago to now? Or do you think there still is some discomfort around funding women's intimate health?
Well, we've seen a huge shift in people embracing menopause. I wouldn't specifically say intimate health. That's still a struggle when you get down to specifically vaginas. But menopause has certainly had a nice upswing in investors. And we see some great companies like MIDI get a lot of funding. That's remarkable. And from big funds like Google Ventures. So that's really encouraging. It's validating that, yes, this is not a niche. This is a real market opportunity for investors. So that's exciting. And also because you have women writing checks now, as opposed to just the men. Even Google Ventures, that the partner involved is a female, not a man behind MIDI. That makes it more comfortable. Yes, women we all have vaginas. So what? Like, it's not something to be embarrassed to talk about or bring up. I am seeing more investments. The one frustrating thing, though, is I still get from investors who may have made an investment in a menopause related company. I'll still get them saying, well, I've already invested in menopause. I have a company in menopause. I'm like, oh my God. First of all, menopause affects half the population. And there's literally 34 different symptoms associated with menopause. And you could treat it so many different ways: telehealth, drugs, devices, an app. There's so many different ways in which you could slice and dice menopause. So for you to say you've already made one investment and you're done is like saying, I'm no longer investing in healthcare because I made one healthcare investment. So narrow minded. And that part really frustrates me.
Totally agree with that. And to consider that funding still is for women owned businesses, it's like 3% of the funds that are given. It still is so low considering we make up 51% of the population and there's so much opportunity.
And 80% of the decision making in a household, whether it's health decisions or purchasing decisions, 80% of it is coming from women. And let's put all that aside. How about the fact that it's been proven women led companies outperform male led companies? And I know why. It's because we work harder. We have to prove ourselves. The bar is higher for us women. So we are constantly trying to demonstrate that we can do what they can and better. So we are just harder, not to digress. But whenever I get an option, if I'm having a medical procedure, they're like, would you prefer a male doctor or a female doctor? Always a female doctor, because in everything in life, women have to work harder to prove themselves. So I know if I have a female doctor, she's kicked ass in med school and worked really hard to get to where she is today.
I so agree with you. It is everything. Everything is harder. Every obstacle is greater. Not only that, but we're doing that all while also raising children and keeping a household together and keeping marriages together or making the decision to separate, part ways, there's so many different things that are placed upon women that are and. to
I have just a really quick real life example that happened to me yesterday that just infuriated me. But I'm giving a investor update to one of our investors, and they had, three other companies on the call. And we are crushing it. We are doing so well. It was so fun delivering this news to these investors on how well the company is performing. And the company before me, male led company, haven't had the successes we have at all. And the feedback is like, oh, thank you, Bob. I won't use their name, but thank you, Bob, for the great work you're doing. And I get up and I just share how we're crushing it. And this is what I got. Oh, thank you, Claire. I'm glad things are finally turned a corner because things were really bad for you. And I'm like, really bad? I mean, yes, we've had to overcome more than our male counterparts, but look what we've accomplished. And it was such a backhanded compliment.
it's kind of remarkable too to not acknowledge and be the fanboying for the other person who's probably checked the box while all of the other people have done all the work for them. And then they give you this backhanded, stupid compliment like, nice try. Nice try. You still have more to go.
Really infuriated me.
Yeah, I'm sure. You've spent years doing the quiet, unglamorous work of breaking stigma, pushing for conversations that most people were too uncomfortable to have. And then 9 years in 2024, your mission became championed by Haley Berry. And then just recently featured in Oprah's Menopause Revolution, like what, 2 weeks ago? That's amazing. That's more than partnership. It's really a spotlight on something that the world once looked away from. What has that felt like for you?
Incredible. So, just to be clear, we weren't 9 years into commercialization. There was a period of time where we're building the technology and testing and going through regulatory clearances and getting approvals around the world for our product. But we were commercial as of 2018 is when we launched. It has been a slower pace growth than a beauty company that can talk about mascara because we're talking about something that has been taboo. And we've had to fight all these little battles, actually quite big battles, like Meta, Facebook wouldn't let us talk about our product, wouldn't let us say what it did or the body part. We were prohibited from talking about the condition because the word menopause and the vagina because that was deemed pornographic. Anything that has to do with women's health, they immediately assume it's pornographic as opposed to an actual body part.
But yet they can objectify women and show all kinds of bodily portraits.
And talk all day long about erectile dysfunction and hard, what's completely double standards. So there was even one point in our history where we were shut down from Facebook. We couldn't advertise, we couldn't post things. And Facebook is made up of 50-year-old women. That is their demographic. And yet we were unable to communicate with their demographic because it was deemed pornographic. So we really needed something to help amplify our message. We needed Oprah. Literally, we needed Oprah. And so about 2 years ago, I got a phone call and I literally thought someone was pranking me. The call went something like this. It went, hi, this is blah, blah, blah. And I'm calling on behalf of Halle Berry. And she would like to talk to you about JoyLux and VFit. And I'm like, what? This is a joke. Someone is playing with me. This can't possibly be happening. Well, it was real. So fast forward, we had the opportunity for me, and I brought my doctor with me, Dr. Sarah Delatorre, because when I was like, I don't think I'm able to talk in front of Halle Berry, right? Like, I think I'll be so starstruck that words won't come out of my mouth. So I need Dr. Sarah there to help me. It was supposed to be a half-hour meeting. We met at Hallie's home, and the very first thing that happens, we walk into her property, and she comes and greets us, not an assistant. She comes and she gives us a hug. And I'm like, oh my God. And that half-hour meeting turned into 2 hours. And she was all in. She's like, I love your mission. I love what you're doing. She personally suffered from, and this is very well documented, she talks about it publicly. She suffered from vaginal dryness and atrophy, which led to a misdiagnosis of her health, which ultimately led to a huge frustration. She discovered BeFit. She used it, loved it. And so what we decided at that meeting was we were going to join forces and really elevate the conversation around menopause and sexual health. She has since then made it her life's mission to be a menopause advocate. So she has her own platform called Respin. She's very vocal about what women go through and her personal struggles. And she's really leaning into this movement and to this topic to help women. And she's doing remarkable things. So here we are. Now a year has gone by because as part of the process, we decided to create a collaboration product, which is an intimacy gel. And this is a incredible, at the end of the day, a lubricant, but it's made with hyaluronic acid, aloe vera, it's pH balance, all clean, non-toxic, and it's FDA cleared, which took us a year to get. We launched together. And so all of it came to fruition in October of 2024 when we made the public announcement. A year went into planning this little guy. She was very involved from the packaging design to this being glass. She wanted to elevate the bedroom experience. She wanted everyone to feel proud to put this on their nightstand, not be ashamed of needing it for sex, but to embrace it. And then also to remind us, it's there, you see it, you're like, honey, tonight's the night. Let's get spinning. So we launched in October and the journey has been incredible. Since then, we've been written up in almost every major publication. She was on the Drew Barrymore show, had an incredible talk with Drew about our products, and then Oprah. So we literally had our Oprah moment, and I was fortunate enough to be with her at the taping. So I was in the audience watching her talk to Oprah about me. She said my name, and I literally started to cry and then talked about how we've partnered and they have VFit and the Let's Spin, and it was incredible. So unfortunately, though, the bit about me and VFit got cut. So when the show aired, you were all sitting around our TV because this was a month and a half later, just, got our popcorn in our bowl and just excited. And then I didn't have my moment. Oprah didn't say my name, but she did in the taping. Nonetheless, it was still a huge success. And to have the photos with Oprah and Hallie and Let's Spin. And we've, of course, put it all over our social media pages and our website. And it's been an incredible high. And I never thought this was winning the Super Bowl as an entrepreneur.
So that personal connection, which came out of nowhere with Hallie, and then having this Oprah moment, I mean, so impactful. Could you have imagined that coming to fruition when you started this company?
No, and I go back to all these really tough times when Meta shut us down or when COVID happened and we were unable to raise money and I had to survive, which we did. All of this has just been incredible.
So much success in the last couple of years, a long journey through productization and compliance and FDA standards, all of the things. Then the process to bring this product to life and really commercialize and sell it. COVID hits, total pain, staying alive, if you will. And now you've had all this success. Looking at that, what is something that just hasn't changed, even with all of the spotlight and with the success that you've had?
Our vision, our mission, and our team. We are still mighty small team. We're like the same women. We've been here since the beginning, and we're all just so committed to making this company a success and transforming the lives of women. And we joke that we all could go get jobs elsewhere and make a lot more money. But We are so committed to helping women and to changing their lives in such a positive, meaningful way. It's what keeps us together. So we have this team and we're like family. Sometimes we fight like family, but we have this incredible family that supports each other and lifts each other up. And that's hasn't changed since day one. Even with Halle Berry on board, we're still a very close knit group that supports each other.
That speaks to authenticity and everyone being on board with the same mission, the same goal of really helping women. Sometimes that acknowledgement from the outside world can make us reevaluate our own narratives. Did this visibility bring up anything unexpectedly emotionally for you?
There's been a lot of validation that's occurred because of Hallie. So things that we knew from day one. We knew what we were doing was right. We knew that our products are best of class. We knew that the potential as a successful company were all there. So we believed from day one, and that's why we've continued to fight the fights and forge ahead. But when Hallie came on board, she was a validator. And that in turn allowed everybody to go, okay, I get it now. It's the real deal. JoyLux is the real deal. And a great example is Ulta. I had been pitching Ulta for at least 5 years. Please take our products where it's the right demographic. It's wellness is important to you. This makes sense. And we could never get their attention. And the minute Hallie came on board, I was able to call them. And I was like, Halle Berry has joined our company. She's a shareholder. She's an investor. She's part of us. We're collaborating. And they're like, oh, okay, well, now let's talk. Those are the examples where we knew all along that we were doing the right thing and we had the formula for a successful company. Everything was as it should be, but Hallie gave it that final validation and now the world is paying attention.
Having those sister wives and having those people in your corner who are going to go to bat for you and really validate that, straighten your crown, lift your crown, elevate you in the marketplace. So beautiful versus those who want to try to sabotage it and try to bring you down or hit the brakes on your successes. What a beautiful gift to have that relationship and that partnership, and still knowing that you knew what you were doing all along and having that validator to really emphasize, yes, you guys were right. And this is so important. What is a question that no one ever asks you about JoyLux, but that you wish they would, because that answer really reveals something essential?
I guess what keeps me up at night, what could go wrong? We've dealt with so many obstacles. This latest announcement on the Trump tariff, that's real scary because that really affects some small businesses because it's immediate. We can't plan for it. We can't course correct and try something else. In our case, we have product on the boat ready to be delivered to the United States. And now I'm hit with a big tax bill. And for everybody listening out there, let me just reiterate, China doesn't pay for the tariffs. We do. The companies that buy products, and in turn, we have to, in some cases, pass those tariffs on to consumers. So it is a consumer tax, not a Chinese tax.
How are you guys going to deal with that?
It's being creative and thankfully that's one of the things that I excel at is seeing a problem and finding 10 different ways to solve that problem. It's going back to how the company started. There was a problem with women's pelvic floor health or vaginal health, and we solved for it. So in this case, it's just another problem we have to solve for. And what I'm very reluctant to do is increase prices to consumers because that's not fair because of someone's political agenda that consumers should suffer. So I'm trying really hard to find creative ways to which the consumer doesn't have to bear this tax. So we shall see, but it's early. Let's hope tomorrow they're suspended or there's a Who knows? It changes every single day. Maybe by the time it airs, they'll be gone. Who knows?
Who knows? I mean, the stop start, it is so difficult. I was talking to a colleague just in passing, and it's one day it's this, the next day is this. It makes it really difficult for businesses to plan, more so to execute, because what do you do in this case?
And the other thing is, if you're, a large company, you have resources. Yes, it's going to hurt you, but the pain is minimal. For us, this is a cash crusher. This is a moment where it could destroy our company if we don't react strategically. We have to do something and we have to make the right decisions, but this could crush us otherwise. So again, we've had this throughout our career. We've had the highs, we've had the lows. So we'll get through this, but it certainly isn't fun. It doesn't make life easy. But then again, if it were easy, everybody would be doing it.
It's true. It goes back to that. Just one more thing to add on to the list of things women founders of small businesses have to do. What advice would you give a FemTech founder who's entering the arena with some brilliant idea or an amazing product that is going to really add value to women on their journey through perimenopause, menopause, pelvic floor dysfunction, intimate health dysfunction, whatever it might be? What advice would you give this up and coming FemTech founder given your journey?
Yeah. So, number one, you have to have a thick skin because you will have 100 people tell you no and that your idea sucks and that it won't work and all the reasons why you should just give up and quit and run away. You will get, for every yes, you'll get 100 no's. And so you can't take it personally. And it may be a no then, it could be a yes someday. And I experienced that with Ulta. They told me no for 5 years and I finally got a yes. You just got to be brave and strong and don't take it personally. It's not about you and just keep marching ahead. To be in this position, one must have a lot of grit and just get in there and make it happen. And well, a lot of entrepreneurs, a lot of male entrepreneurs have a path that goes like this straight ahead or like this. Ours is like this. And you just have to be willing to go with the flow and problem solve and figure it all out. Don't give up. Thick skin, don't give up and have grit.
Soft heart and strong spine, right?
Yeah.
This, Drew, is what changed my life. It wasn't the ring, it wasn't the estrogen. That's how I met Dr. Sarah right here. And I met with Dr. Sarah from JoyLux, and they said, we have this VFit. It's a red light device that you insert, and you do it like 10 minutes a day for about 2 weeks at first. And all you do, Drew, is you take it and you insert it.
Okay.
I did that. You put that in, you just lay back, do whatever you're going to do, scroll your phone, read something, call somebody. And in 10 minutes, you take it out. And I would do that every morning for 2 weeks. In 2 weeks,
Really?
the razor blades left.
Building JoyLux. And so creating the device was one thing. Building an ecosystem around a women's health product is something else entirely. And VFit isn't really just a device. It's technology backed by science, regulated for safety, designed for real-world use, and now supported by a fully digital application as well. From concept to compliance, when it comes to the teams and the people behind your product, what were some of the most complex moving parts of bringing VFit to life?
Certainly, the most complex was the technology. Red light is ubiquitous. We see it in everything. We can see it in our cell phones. There are a lot of facial devices for facial rejuvenation that use red light. All of those products basically don't do anything. They're not therapeutic. They claim to be therapeutic, but they're not. What we're truly delivering with this red light is very therapeutic. And as one of the results of that, this is a really high-powered device. There is a lot of things that we had to deal with, like heat. when you have a battery that emits a lot of heat, you need to dissipate the heat. And how do you do that in a small, compact device? So, believe it or not, the insides of this are incredibly complex with a lot of innovation that happened, the creation of this that is not obvious to the end consumer. So we spent a good 2 years and a lot of testing and validation to make sure that the device delivered therapeutic benefits, but safe therapeutic benefits. And so there was a lot of modeling we did, a lot of testing. The other thing too is just there's not a lot of people in the world that understand the mechanism of action and the technology behind therapeutic photobiomodulation therapy or red light therapy. Like you're studying it in school and I could just go to any college and grab kids. I mean, this is a very small niche area of expertise. So I pretty much know everybody that's in this field and have had the opportunity to work with everybody to master what is now VFit.
What are some of the results from a therapeutic perspective and the benefits? What have you been able to reference as successes and wins for women utilizing VFit?
We've actually done quite a few clinical studies. So a couple of them have been published in peer-reviewed medical journals, and I encourage everybody to read the published studies because they're remarkable. But what we were able to prove is that with red light therapy, we are able to build new collagen and elastin. So we did vaginal biopsies where we could show pre and post treatments, the new collagen formation in the tissue. And when we know you have collagen in your tissue's more plump, it's more tight, has more elasticity. So we've proven that through clinical studies with vaginal biopsies so we can visually see the changes in the tissue. Blood flow, that's another important thing that is good for tissue health. Anywhere in your body, you have blood flow to bring oxygen, proteins, nutrients to your tissue all over. If you have an injury, your blood flows to that to help heal and repair that injury. So whether it's a cut, it's all about the blood flow because that blood flow is bringing, like I said, oxygen, proteins, nutrients to heal. Again, we were able to demonstrate that red light increased the nitric oxide, which is responsible for the production of blood flow. And we saw more vascularization in the tissue. We saw more blood vessels form in the tissue as a result of our technology. Then the clinical benefits, like women saw a reduction in stress urinary incontinence, an improvement in pelvic floor muscle strength. They saw a reduction in vaginal dryness. They saw a reduction in pain with intercourse because things were more lubricated and healthier. So that anti-inflammatory response that comes from inflammation from pain with sex, that was gone. So we've clinically proven that these things work and we've published the results. And that's really hard for any company to do because clinical studies are incredibly expensive to do. And I don't think consumers understand that the amount of money that goes into designing and executing a true clinical study. It's mind-blowing how expensive they are.
I can't even imagine. And not to make light of that by any means, because there's so much great information in that, but consumers just want answers too. Just sounds like JoyLux has a really great solution for so many different health challenges that women experience.
Yeah, so maybe it's not VFit, but our intimacy gel that provides immediate relief for intercourse. It provides immediate hydration. So if you're someone that suffers and this is what resonates with you, then we have this, and this is best of class. And we've studied this on 100 women. So there's a lot of things that we do to validate that our technology works. At the end of the day, though, what I'm most proud of is the consumer testimonials. And we've treated literally hundreds of thousands of women, and the results speak for themselves. The reviews speak for themselves. We're not paying these women to say these things. They're saying it, they're sharing it with the world because they also feel passionate about the changes they're seeing in their health. And that, to me, at the end of the day, is way more valuable than a clinical study. To me, that's real life. It's what these women feel, and it's what's giving them renewed confidence and improved health. And that, to me, is where any product, that's what you want to see, is that women feel like it's making a difference in their lives.
And validating their challenges, what they're experiencing. I love that. Did you ever have to fight for your vision internally, not just externally in terms of, I know you mentioned you've got a really amazing team.
Well, my team and I fight all the time. Heather, head of marketing, and I are like sisters, or at least I think that. She may say otherwise. But I'm yelling all the time. She, yells back. There's daily discussions. So we'll say healthy discussions, but we feel passionate about it. We feel passionate. The tariffs is a great example. Like, there is a team member that feels passionate about adding the tariffs on as a line item to the checkout process. So everybody understands how these tariffs affect the consumers. And then there's me that's like, I don't want to raise prices. I want to try and weather this storm without raising prices. And I'm passionate about that. And so there's a lot of healthy dialogue that happens every single day. We're all kind of fighting for what we believe in and what's the right decision. And at the end of the day, though, we have to agree on something and move forward.
Right. And as you're making products that feel approachable for consumers and powerful for their health and well-being. When you first started this, and even now as you've evolved, because I think every stage of growth for a company, different roles are needed. What were the key roles that you needed early on compared to now as you are really expanding into this women's wellness market? Like 1,000%.
When we started early on, we weren't having the traction that we are having now. So we often asked ourselves, is it the right product? Is it the right messaging? Are we missing a product? So early on, we actually tried quite a few things that didn't work, but we thought we needed to try it. So we went with a broader menopause message instead of being like the go-to intimate health solution provider that focuses on vaginal health. We were come to JoyLux for everything related to menopause. So we had supplements, we had hot flash products, we had like all these products to cater to all the various needs that a woman deals with during menopause. Now we're like, no, we know our lane. We are all about intimate health. We are all about the vagina. So when someone comes to us and says, hey, I have this great idea, would you be interested in this product for you? We're like, if it doesn't meet our objective, no. There's lots of supplements out there. There's lots of menopause companies now. Let them do it. We own the lane of intimate health. So we now say, if we can't make this work with that lens, then it shouldn't be part of our portfolio of products.
You do have an app which is supporting the technology. Can you speak more about that? And what does that digital layer offer your end users?
Yeah, so interestingly, the app does cover all things menopause. So it's not just about vaginal health. And I do believe women find a lot of value in that because the metrics speak for themselves. This app is the second highest rated menopause app in the App Store. It has super high engagement. On average, women are coming 6 times a week to visit, interact with this app. They're reading the articles. So we're putting articles not just about sexual health or vaginal health, but we're putting articles on there about hot flashes and weight gain and all things that women deal with in menopause. And that is resonating with them. So in that regard, we are offering them much more than sticking to our lane. Having said that, the cost to do so from a business perspective is minimal. It's digital content. We're going to create it, and it's not like we're inventing a new product that requires a lot of R&D, a lot of upfront investment. This is a piece of digital content. So in that regard, we've gone broad, and it is resonating, and women are finding value in our menopause symptoms tracker and all the insights and education we provide on broad menopause topics.
That's awesome. And do you have a separate team that has been developing and creating that and developing the content for that?
Oh yeah, we have a team that does that, but we're still a very small company, so we all have our hands in everything.
Yes, most definitely. I saw that. How many people are on your team?
We have a team of 15. Having said that, we do outsource a lot of our functions. So the reality is it takes a lot more than 15 people to deliver what we do, but we work with our social media teams in this place and outsourced. Our engineering team is outsourced. So this stage and size of a company, it makes perfect sense because we can dial up or dial down as needed.
And as you even mentioned, you can't be everything to everyone. And you have to have dialed objectives and what you're clearly good at, and then outsource and leverage people who are really good at whatever their lane happens to be and bring all of those players together.
And as I mentioned, Brenda, earlier, is that what we are doing, it affects a huge population. The population is not niche, but specifically our knowledge base and our technology and what we're doing does have a very niche pool of people that get it and understand it. So it's not like I could be here in Seattle and go find 4 engineers that specialize in photobiomodulation therapy. I had to go far to find those people. So having an organization that is virtual and connected and may or may not be actual employees, but consultants works for us.
Love it. That's amazing.
Are you a woman leader, CEO, or hiring executive looking to build a powerhouse team? At EDM Talent, we specialize in connecting top-tier talent with companies that are redefining the future. Whether you're scaling a startup, diversifying your leadership team, or searching for mission-driven professionals who align with your vision, we've got you covered. With a people-first approach, we help you hire exceptional talent who not only meet the job description, but elevate your organization. Let's build something incredible together. EDM Talent, where great companies meet great people. Let's talk. Visit idiomtalent.com today.
You've been in business now for over 10 years. What does the next 10 years look like for you?
We're going to ride this till the very end and into the sunset. And we think it will have a happy ending because we're doing all the right things and our metrics and the growth we're experiencing is best of class for any company of our stage and size. So we're really proud about that. And another 10 years, truthfully, I will be an old lady. So I hope to be retired and spend time with my family who unfortunately have been the ones that suffer the most when they have a CEO entrepreneur mom. So that's where I hope to be in 10 years is someone else continues to take JoyLux to the next level, but I'll be retired.
In the interim, what are you doing to take care of yourself?
Now that's a good question. That's the one I don't get asked. And in fact, being the CEO, seldom do people go like this and say, "Good job, Colette," or "What can we do for you?" I am constantly being the one saying, "Thank you. Thank you for your investment. Thank you for being a customer. Thank you for showing up to work today. Thank you, thank you, thank you. Thank you for helping us." And I seldom get the thank you back. But that's expected. That's what happens when you are at the top of the pyramid. It's just par for the course. And so one of these days, I know I will get that pat on the back and say, "Thank you, Colette." But until then, I just try and find moments where I can just reflect and look at the successes we have and be proud of what I've created along with my team. And if I'm not doing that, I'm out playing tennis because tennis is the one thing that totally allows me to disconnect from the business world. And when I'm on that tennis court, I'm just hitting that ball hard and thinking only about that tennis ball.
That's such a really good reminder because as CEOs, as executives or leaders, leading these businesses, leading the charge, you also go home and you're leading a family. You're doing all of the things for the children, for planning, get togethers, whatever it might be. But we carry a lot of weight. And hitting the ball on the tennis court really allows you to reduce some of that stress and resurrect that passion and life inside of you to get up and be able to show up and do it again tomorrow. It's not always easy though, especially when you have to approach the thank yous with so much humility on a regular basis. What do you still want to create but haven't had the runway to do yet?
I think we've done it all. Yeah, I want to create a happy ending for the company. We really are at a career high. Personally, I'm at a career high. The company is at a high. The team, they're all killing it, doing such an incredible job. So what we want to create is a happy ending.
Love it. In more ways than one, right?
You said it, not me.
What's one assumption about women's health treatments that you believe really should be challenged? And how do we shift that conversation, Colette?
People think this is a niche. It's not a niche. It's 50% of the population, and a majority of those women, call it 75%, will experience one or more women's health issues that are specific to women that men don't experience. So it's not a niche. It's a huge population, and people need to get behind it and support it and realize that, yes, we need clinical research dollars that go specifically to women because we are different, we are unique, and it requires unique treatment.
Most definitely. Our audience has heard it here. JoyLux work isn't just about products. It really is about permission to talk, permission to be heard. And for our listeners, you can visit joylux.com and use code REDEFINE at checkout to receive 15% off individual JoyLux products. So join the movement that's breaking the silence. Go get your VFit device, sign up for the app, take advantage of all of these tools and products that are designed by women for women to really enhance and benefit your own well-being. My last question for you, and this was left from a past guest, Colette. How do you keep your ego from getting ahead of your mission, especially when the world is clapping loudly and things are going so well?
You have a 10-year-old son who reminds you daily that you're not that special.
Our children are our best teachers and like our worst enemies some days, but also so beautiful. We're fortunate to have them. Well, it has been great to connect with you today. I so appreciate you being on here and having the opportunity to just elevate your voice. I started Redefine Her for a similar reason as you, to really help women and help women be heard and seen. So thank you for joining me on my mission as well.
Brenda, it's been such a pleasure. It's been really fun talking with you, and thank you for what you're doing, because this takes a village to support women. It's not just, one company, one person. It's a team of women that are all have a shared vision of helping women feel empowered and confident in their daily lives.
Thank you. That is a perfect note to end on. What a great conversation. JoyLux isn't just riding a trend. It's a therapeutic tool, a science-backed wellness device that's helping women reclaim their bodies and their confidence. In a women's health market now valued at $360 billion, innovation like this isn't radical. It's long overdue, in fact. If you've got a bold idea in women's wellness, we hope Colette's journey has been inspiring. And we hope it reminds you, the world may not be ready, but build it anyways. It takes a village, and we're here, listening, cheering you on. Thanks for joining us on Redefine Her today. If you enjoyed this conversation, don't forget to subscribe here or anywhere you listen to your favorite podcast. And be sure to share, like, and leave a review. Together, let's continue to redefine what's possible in women's health and wellness. Until next time, stay inspired, stay empowered, and keep redefining her. This episode of Redefine Her is produced by Taryn Long and Brenda Armstrong and proudly sponsored by Idiom Talent Partners, experts in search and placement services for health tech and femtech companies focused on building dynamic, inclusive teams. Learn more at idiomtalent.com.